everyone, my name is Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. Today we're going to be talking about how do you interview a pediatrician. So as you all know, I own my own practice and I love newborns. I love doing meet and greets with prospective parents and meet and greets with people who are already parents and have children and are just shopping around for a new pediatrician. But a lot of parents who might be looking for a pediatrician aren't sure what questions to ask. So this video is meant to guide you on that. First off, I recommend starting with something like office policies. So you want to ask about their well check schedule. When it comes to sick appointments, do they offer same day appointments, right? Because one day your child wakes up with a fever and you didn't even know, but you have to go see the pediatrician. So do they offer same day or next day appointments? What about evening appointments? Do they offer something on the weekends? Do they offer something in the evenings if you don't want to take off work? Speaking of unpredictability with children, you and I both know that you have all the plans to show up to a doctor's appointment on time, and then maybe your child has a diaper explosion, or maybe your child was feeling ill and they threw up in the car. All of these things, it's really hard to know. So do they have a late policy? Is there a no-show policy? Now, I highly recommend if you're having to cancel an appointment, please don't no-show. Let us know in advance. It's not a big deal. There's no penalty usually, but again, this is a good question to ask. But we really appreciate it on the clinic side if you let us know if you're not going to be coming to an appointment. Other things to know about when it comes to an office policy for a pediatrician is who works there. Now, you might know about front desk staff, you might know about receptionists, MAs, nurses, but when it comes to who's seeing your child clinically, is it a pediatrician who's a physician? Are they mid-level providers? What's the experience? What's the background? What's the training when it comes to who's going to be seeing your child and assessing them clinically? Speaking of, is there just one provider? We call that a solo practice. So my practice is a solo practice, or are there multiple people in the practice? And usually this is helpful, especially for if there's going to be hospital privileges. So if you're going to be delivering your baby, who's going to be rounding in the hospital? And or are you going to be seeing a newborn hospitalist while your baby's born in the hospital, and then you're going to follow up with the pediatrician outpatient, and that pediatrician doesn't come to the hospital. So those are all important things to know when it comes to office policies. So that question kind of goes into, does your doctor do inpatient or are they purely outpatient? So if you aren't aware, inpatient has to do with anything really in the hospital, and outpatient is anything really in a clinic. So for example, I'm strictly outpatient because I am a solo practice. And so I can't really cut myself in two and be in the hospital and be in clinic. So that's the way I structure my practice. Other things you might want to ask about is, what is the level of diagnostic testing that's being done in the practice? So some practices do things that we call point of care testing. So you maybe swab the throat or swab the nose and you would get a result immediately. Some practices might actually have a lab in their office or a phlebotomist where you can actually get your blood drawn in the office, sent out, and the results will be given there. Maybe not at the same appointment, but you can get your blood drawn there. I think that's really helpful to know because although we don't do a ton of labs in pediatric, which is a big perspective for parents to understand, they think labs are being done frequently, but we actually don't do a lot of labs for kids. But if you are having to get labs drawn, are you going to get them done at the office? Or are you going somewhere else to get those pediatric labs drawn? So another big topic, in my opinion, is communication. I think it's really helpful for parents to know what are the different ways that I can communicate with my child's pediatrician. Is it always going to be calling the doctor's office, talking to the nurse first, and then the nurse will get back to me? Is there a chance that the doctor can talk to me? Do I have access to the doctor's email? Is there a patient portal that I can talk to the doctor through? So for example, in my practice, my patients can actually text me, they can email me, they can use the patient portal, or they can call me directly. Those are all methods, but maybe those aren't methods that are all available in every single practice. So you'll want to ask about what are the communication methods. You'll also want to ask, is there availability to make or request appointments online? Because for some people, especially in the millennial generation, we're a lot more comfortable just typing in a conversion form and hoping that somebody calls us back, or e-booking ourselves and taking a slot. And for many reasons, this doesn't actually work well when it comes to healthcare. And not every patient is the same. So an asthmatic who gets sick, we'll want to make sure we're able to assist them for a longer period of time, or assessing a newborn's well child check might take a little bit longer than other appointments. So maybe e-booking isn't an option. You'll want to ask about that. When it comes to communication, I also think it's really helpful to know that if you are getting labs drawn, who's going to be communicating the results back to you. So for me, it was helpful to know that I'm talking to a doctor, or is the nurse communicating the results back to me? If they're abnormal, who's going to give me the plan of action? Usually it's the doctor, but sometimes if they're normal, it might be the nurse, or it might just be the receptionist. There's all types of different communication methods and different systems in place that varies per practice. So in my practice, for example, I communicate the results if they're normal or abnormal. It's me, the physician, who's doing so. And of course, if they're abnormal, then I come up with that plan of action right there with the family and I communicate that to them. On that note, I think it's also helpful to know that if you're calling after hours, if you're calling the on-call doctor, what's the way to do that? Is there a triage service on call? Am I going to call? And does that page go to the doctor who's on call? How long will it take for the doctor to get back to me? Those are all really helpful questions to know. So for example, in my practice, I gave you all the methods that families have to communicate with me, and I give them the time span. So it's going to be X amount of hours to get back to you with a text, or if you call me, how long it might take, if there's an emergency, what number you can call, etc. So you'll want to ask about those things as well. So moving on from office policies and communication, let's get to the nitty-gritty of pediatrics. You'll also want to ask potentially views on important topics. Now this is very important now, where I think it's an age of misinformation and families might come in with different perspectives, and they might want to know, where does their pediatrician stand on antibiotic usage or vaccines? Potentially, where does your pediatrician fall when it comes to breastfeeding knowledge, sleep training, vitamins, supplements? These are all really controversial topics, actually, that I have talked about a ton on this channel, but also on my Instagram, on TikTok, on many social media platforms. And I think it's very helpful to ask your pediatrician about these topics if it's something that intrigues you. I definitely talk about these topics very commonly with my prospective patients. They can ask me about breastfeeding. They can ask me about pacifier usage. They can ask me about sleep training. I've had many parents talk to me about vaccines, where they stand, what questions they have. And I highly, highly encourage it, because this is going to be a long-term relationship and you'll want to know if you can jive with them. Now that being said, I want you to know that it's not permanent. If for some reason you decide to switch your pediatrician practice, it's not the end of the world. All you have to do is find a new pediatrician. You can use this video as a guide of which questions to ask. Get your records transferred. It's okay. I have actually changed pediatricians a few times for my kids. It's okay if the pediatrician that you picked at the newborn period isn't the one that you continue on with. But these might be important questions to know if you're going to be starting off on a good footing early on. All right, what about questions on background? This is really important to know that there are some things that are off topic and are not recommended or allowed to be asked. And then there's others that you can ask. So first, let's talk about what questions you can ask. You can ask, how long has the pediatrician been practicing? Where they went to medical school? Where they did residency. You can ask if they're board certified in pediatrics. You can even ask personal questions about what made you go into pediatrics. But personal questions like talking about, are you married? How old your doctor is? If he or she is a parent, those are things that really aren't appropriate to ask. Now, if your pediatrician offers that information on their own, that's different. That's them volunteering that information. But you can't really ask, are you married or how old you are. You can definitely ask how many years of training they've had, but otherwise there's some topics that are just not appropriate to ask, and those questions would be some of those. I hope that was really helpful for you. I hope you took notes, because if you are interviewing your pediatrician, these are great places to start when it comes to questions and topics you'll want to dissect. And maybe you'll even want to talk to your significant other, your spouse, your partner about what's important to them. Other really important things you might want to ask about and consider is the distance, right? So you may not want to pick a pediatrician who's 30, 45 minutes away. You may not think that's a big deal, but when it comes to having a child and then planning a nap schedule, planning feedings and the appointment, potentially the wait time, those are all things you'll want to consider. So maybe Googling and timing yourself when you're driving to that office is important. You'll want to ask potentially about wait time. You might also want to ask about and assess the parking situation. So So I live in New Jersey, and in the Northeast, parking can be a little bit difficult. So you'll want to consider that. You'll want to consider what's the parking situation like, because that could potentially make you late, right? Traffic, if your pediatrician's office is 30, 40 minutes away, then thinking about how you're going to find a parking spot, how far is the parking lot to the clinic, because if you're dragging a very heavy car seat and a baby with you, those things are not going to be easy. So those are all just sort of logistical, practical things to think about when it comes to picking your pediatrician's office, etc. All right, if I missed anything, make sure to let me know in the comments. I'm curious to know, what questions did you ask your pediatrician that I didn't mention? If this video was helpful, make sure you give it a thumbs up. Subscribe if you'd like to see more of this kind of content. And I hope you guys have a good week. Bye.